Welcome to this short webinar introducing the Gentian SARS-CoV-2 antibody immunoassay, which is available on open-channel clinical chemistry analysis. With the shift of the SARS-CoV-2 pandemic into the post-vaccine phase, where large proportions of the populations are vaccinated, it becomes more and more important to understand the protection level against reinfection and severe diseases to manage the virus on individual and society level. Serology testing to monitor antibody levels is an important part of this active surveillance of virus behavior and protection status of the society. Gentian has developed a turbidimetric SARS-CoV-2 antibody assay, bringing a high-quality and fast-throughput serology assay on automated clinical chemistry platforms, increasing the test capacity for routine antibody testing. It will remain to be crucial to understand the development of this virus and its implications for the future. With this test, we provide a tool for the long-term surveillance of both the immunity of the society and also the virus behavior, including virus variations. This antibody test will measure the whole antibody response and thereby help in the guidance of educated decisions about risk management, vaccination strategy, and potentially new vaccines' efficacies. Standardized quantitative antibody testing opens the possibility to document the protection for the population and individuals, which is important to help make better health-related decisions both for personal vaccination decisions and the pandemic management. So how will the Gentian SARS-CoV-2 antibody immunoassay provide answers to these crucial clinical questions? This assay will provide a quantitative detection of the total antibody response targeting the S1 subunit of the spike protein. By targeting specifically the S1 subunit, which is the vital protein fragment for the immune reaction, it will be able to identify patients with an adaptive immune response. Importantly, it will capture the antibody response relevant for protective immunity after infection and explicitly detects antibodies induced by vaccine targeting the same protein fragment. For laboratories, this test can be easily implemented in current routines since the SARS-CoV-2 antibody test is an open-channel turbidimetric assay and it can be run on all major clinical chemistry analyzers. Looking at the technical side of the assay, testing of clinical samples showed reliable results with high sensitivity and specificity. Since the test measures the total antibody levels, it will capture the whole immune response, including IgG, IgM, and IgA. And as discussed earlier, as the test is targeting the whole S1 subunit, the assay will cover multiple virus variants. Importantly, the test is fully aligned with the new WHO international standard, so quantitative results can be compared across laboratories and other standardized assays. And in regards to the practical implementation of the assay, as I mentioned, the Gentian SARS-CoV-2 antibody immunoassay is a turbidimetric assay to be run on the open channel of clinical chemistry analyzers. These clinical analyzers are already installed with a large footprint worldwide. This means there is no extra infrastructure needed. This is a standard blood test easily integrated in a routine blood protocol, starting with the blood sampling at the doctor's office to the report of test results from centralized laboratories. The assay itself is easily set up on the available clinical chemistry analyzers, and with the fast and high throughput, the test will only take 10 minutes to run. With the available infrastructure and the seamless integration into existing workflow, this test will thereby be very cost efficient. So finally, I would like to share some results from our internal testing as an illustration of the ability of antibody testing. It clearly shows an increase in antibody levels with the first dose of vaccination and a strong further increase with the second dose. With these encouraging results, we have now a tool to give easily available and important input for the future SARS-CoV-2 management. Thank you for your attention and please reach out to us if you have any questions.